Today here at Beverly Hills Plastic Surgery Group, we're going to walk you through how we administer Botox. So, what I'm going to do is just clean off the area, just to remove any excess oil so we don't introduce it into the skin. There are a few different areas that we target. And the first will be the frown lines, which essentially are right here that form what are called the 11s, or commonly known as. Other are the area of the forehead where we have horizontal lines, and then what are commonly referred to as crow's feet, which are just at the lateral aspect of the eyes. We'll target each one of the areas to address a single area. Sometimes I think has been popular in the past. However, it can cause a distorted appearance to the forehead, and so we generally try to at least treat two areas so it looks to be in harmony. Now, using a 30 gauge needle, 1/2 inch, there are a few key muscles that we target. The first is the procerus, which essentially originates and inserts from the center of the eyes in the middle of the forehead down to the nose, and it'll cause some of the horizontal lines that you'll see over the bridge of the nose. I like to tap just a tiny bit. It basically distracts some of the nerves and sometimes leads to less pain upon injecting. As targeting this portion of the muscle, also there are corrugator muscles that will, or the origin and insertion are really at the medial aspect of the upper brow over into the nose as well. And these are really what form the 11s. So you can see as I pull these together, as the muscles contract, they'll form these deeper lines. I'll hold the muscle in between my thumb and forefinger and inject into the center portion of the muscle belly. And I'll do small increments of 2 to 4 units depending on the injection site. Again, pinching the muscle between my thumb and forefinger. The whole idea at this practice is definitely not to freeze the forehead or make it look abnormal, but to give a natural, rested appearance. So if this means adding less Botox, I can always add more. It's just a little more difficult to take it away. Now I've targeted the central areas which form the 11s. Now I'm going to head up into the forehead where you have horizontal lines that develop. And again, anywhere there is a large muscle perpendicular to that, you'll form a line. So there are 2 large muscles called the Frontalis muscle that basically traverse in this direction, and that's why you'll form horizontal lines. Again, small depots of 4 units. Thought that went well. Now the problem with just doing the central forehead is that the lateral aspect of the frontalis muscle will take over, and sometimes it peaks the eyebrows. Now we do want it to give the lateral eyebrow just a little bit of a lift, so I'll add just 2 units to the outer aspect of the forehead on either side, just to soften the brow. Without that, sometimes you get that peaked or Spock look, which unfortunately is very common. You don't necessarily need multiple injection sites along the area of the muscle. You just need to target the central aspect of the muscle, because we still want them to make facial expressions. We don't want to entirely freeze the forehead. We just want it to be a little more difficult to make those deeper lines. I'm just going to turn her head gently to the left. These perioral rhytids, or crow's feet as we call them, basically are a result of the orbicularis muscle, which travels around the eye. I like to ask them to squint their eyes really tightly, and you can see where the muscle contracts. Now relax. This is the area that I target. So I would like, in between again, thumb and forefinger, to grab the orbicularis muscle and into the center portion of the muscle belly, inject. And you can do either 2 units at a time. Now, the last thing that you want to do is travel too far inferiorly, because what will happen is actually you'll lose some of the tone to the lower eyelid. And sometimes you'll see that, especially as we age, we lose tone to the orbicularis muscle, and that's why the eyelid tends to have an inverted appearance. So we really just stick just to the outside here. And I'll do the same thing to the other opposite side. And I'll have you